Well, good evening and welcome to Queer News Tonight. This is the world's first and only LGBTQ plus daily evening television news. We're broadcasting live and then we're available on demand and available on all smart televisions, including Roku, Apple TV, Android TV, Amazon Fire TV, Twitch, YouTube, and Facebook. It's time to queer up the news for Tuesday, May 7th, 2024. We are literally out of the closet and into the headlines. So many of your important stories we're going to tell on Queer News tonight.
This is the world's first live daily LGBTQ evening news show, literally out of the closet and into the headlines on Queer News Tonight.
Well, this is a special broadcast of Queer News Tonight, LGBTQ plus Healthcare Edition with Holy Cross Health. We are going to talk about the state of LGBTQ plus healthcare in America and the progress we need to make to continue to support, serve, and help the queer community in the vital area of healthcare.
This is the world's first and only unedited live LGBTQ plus evening news show. Whatever happens unique in the LGBTQ plus news, you will see it and hear it.
Hotspots Magazine, Happening Out Television Network, is a nonprofit 501c3 media company in the same model of PBS and NPR, but designed for the LGBTQ plus community. Our mission is to support the 11 pillars of our LGBTQ plus community. We want to inform and educate the key issues of our queer culture, the Black community, Latino, lesbians and queer women, trans, students and youth, seniors, business, social justice, faith, and this special edition focusing on HIV/AIDS, LGBTQ plus healthcare. Help us support our community.
We are part of one of the largest LGBTQ plus nonprofit media companies in America, Hotspots Magazine and Happening Out Television Network.
In 2024, our magazine is celebrating 40 years of the LGBTQ plus experience, and our television news, talk, and entertainment shows support our mission to educate the LGBTQ plus and broader community. So let's meet tonight's anchors at Queer News Tonight, Holy Cross Health Edition. Let's first up welcome anchor Vaughn Biggs, the Vice Chair of the Broward County HIV Health Services Planning Council and a new member of the National Minority AIDS Council HIV 50 plus strong and healthy cohort. As such, he is one of the great voices of our local support for LGBTQ plus healthcare. Vaughn is a trailblazer in the fight against HIV/AIDS and a beacon of hope for many. In our LGBTQ plus community, Vaughn is what we call a disruptive advocate who tirelessly challenges outdated perceptions surrounding HIV/AIDS. In his role as the community outreach coordinator for Holy Cross Health, Vaughn continues to dismantle stigma and inspire change through innovative campaigns, ensuring that the message of hope and resilience reaches far and wide. Vaughn provides a unique perspective for Queer News Tonight Healthcare Edition, as he is literally in the community trenches in the fight for LGBTQ plus health equity. Welcome, Vaughn.
Thank you so much, Al. It's great to be back.
It is absolutely that, and I can't wait for this conversation. Next, let's welcome anchor Kim Saiswick, the Vice President of Community Health and Well-Being at Holy Cross Health. She spearheads environmental change, strategies, and outreach programs across the nonprofit hospital's service area. With over 3 decades of experience, she has been a national expert in HIV/AIDS patient care and serves as Broward County's patient care representative representative on the Florida Coordinated Planning Network. Kim is involved with local and statewide policy alongside community peers and colleagues to advocate for LGBTQ+ health equity, ending systemic racism, change and improvement in health-related systems with a special focus on vulnerable, disenfranchised, and poor individuals and families. Kim provides a unique perspective for Queer News Tonight's Healthcare edition, as she has a bachelor in nursing, master's in psychology, and a doctorate in leadership. Welcome, Kim.
Thank you so much, Al. Pleasure to be here.
Yes, and it's going to be a great conversation. Next, let's welcome anchor Rudy Molinet, a fellow at the American College of Healthcare Executives. He brings over 40 years of senior healthcare management and executive experience in helping a variety of healthcare settings, including nonprofit organizations. He is also the recipient of the prestigious Regents Award from the American College of Healthcare Executives. He holds a bachelor's in nursing and a master's in public health administration. He served as executive vice president for Stadlander's CVS ProCare Pharmacy. Rudy is also an adjunct professor at Florida Atlantic University's College of Business. Very notable, in January, Rudy became chair of the board of Holy Cross Health. This historic moment is the first ever representation of its kind from the LGBTQ+ community for the faith-based Holy Cross Hospital and healthcare system. As a member of the LGBTQ+ community and a resident of Wilton Manors, Rudy provides a unique perspective for Queer News Tonight's Healthcare edition on the importance of top executive leadership at healthcare institutions and their impact on the delivery for better LGBTQ+ healthcare. Welcome, Rudy.
Thank you, Al. It's an honor to be here.
I have to ask you right off the bat before we get into tonight's stories, the appointment of board chair, that was a significant moment for our community. What did you think when that happened?
Yeah, so when I was asked to serve on the board 3 years ago now as the first openly gay board member, our CEO, Mark Doyle, approached me actually at FAU. He came to speak with my students, and he said, we really would like to have someone on our board who has a healthcare leadership background and a member of the LGBTQ community, because so many of our patients and families who we serve are from the community, right, because of our catchment area. And I joined the board. After a year, was asked to serve as vice chair, and then in January was elected to be the chair. And it's very humbling. I think there's an old saying that if you don't have a seat at the table, you're at on the menu. And I feel really privileged, frankly, to be able to be there to bring the voice of the LGBTQ community to the board, to our leadership team. We've been doing this for decades. Kim, my co-host here, has been doing it, and as many others as well, Vaughn and others. And it's nice to be able to say that our board is truly inclusive.
It's an amazing story that really is the theme of this special edition of Queer News Tonight. Vaughn, member of the community, of course, the LGBTQ community. Kim, such an amazing advocate, ally of the LGBT community. And then your election as board chair. It is not lost on me that Holy Cross is a name that the LGBTQ recommends in terms of understanding what Holy Cross represents. And in healthcare, it's very interesting in terms of its place in community, which historically may not have been a natural great supporter. And as we explore tonight, we're going to find that that's absolutely the opposite is true. So welcome everyone for being anchors with us on this special edition.
And of course, this is tonight's lead anchor, the gay guru, Al Ferguson. He has traveled to more than 137 countries worldwide. Al has hosted and coordinated with RuPaul's Drag Race for many seasons and is the creative inspiration for this show, Queer News Tonight, and the original host of It's Happening Out. Today, he is an executive producer and content creator for Hotspot's Happening Out and will host the national broadcast of Wilton Manor's Stonewall Pride Parade and Festival June 15th. Welcome, Al.
I'm excited to be here tonight, and this is a wonderful special edition of Queer News Tonight because it allows us to focus on healthcare in perhaps many different ways that our community doesn't think about, which you're getting ready to hear all about. Well, we are the reporters for Queer News Tonight, and this evening we begin with the queer headlines. The LGBTQ plus community in South Florida and across America is diverse. Our community across the world is vast, and here are the bullet points of the queer news for today, Tuesday, May 7th, 2024. First this evening, let's queer up the worldview. A new study reveals how discrimination intersects LGBTQ plus challenges for healthcare and medicine. In the United Kingdom, LGBTQ plus History Month 2024 will honor the significant contributions of LGBTQ plus individuals to the field of medicine and healthcare. This year's theme has been selected and announced as Medicine Under the Scope. It highlights achievements while spotlighting ongoing challenges in the face of rising hate crimes against the LGBTQ plus community. A survey by the British Medical Association, called BMA, and the Association of LGBTQ plus Doctors and Dentists reveals stark discrepancies in medical workplace experiences. For example, only 26% of heterosexual respondents to the survey recognize homophobia as an issue. Contrast that to 71% of LGBTQ plus respondents. It emphasizes the need for awareness and support within the medical profession itself. The British Medical Association states, quote, discrimination against LGBTQ plus staff not only affects their well-being, but also impacts the quality of care provided to patients. Studies by Stonewall reveal that a significant portion of LGBTQ plus individuals have witnessed or experienced discriminatory remarks from healthcare staff, leading some to avoid seeking treatment altogether. In particular, transgender patients report unequal treatment, highlighting the urgent need for inclusive healthcare practices, end quote. The Royal Society reports 20% underrepresentation of LGBTQ plus individuals in healthcare, emphasizing the importance of diversity in fostering innovation and inclusion and inclusive environments. To support LGBTQ plus individuals, the BMA advocates for comprehensive training of healthcare workplace inclusion, LGBTQ plus leadership programs, and increased visibility of LGBTQ plus role models. Implementing feedback mechanisms, addressing intersectional issues, and creating inclusive workplace policies are essential steps toward fostering a supportive environment. The BMA concluded that improving LGBTQ plus visibility in healthcare delivery dramatically improved overall healthcare for the LGBTQ plus community. By championing inclusivity, workplaces can set a precedent for equitable treatment and create environments where all individuals can thrive and contribute to advancements in medicine and healthcare. This was an amazing statement to me. This survey really brought me to a stop. Thousands of stories that we have done at Queer News Tonight, at Hotspots and happening out about healthcare in LGBT. This was something new that I hadn't considered before, because we focus on the delivery of healthcare as the individual, as the patient. What the British Medical Association was drawing attention to is that starts at the institutional level, and great healthcare must be great in the institutions that deliver healthcare. It was an all-stop moment for me that really was part of the inspiration of doing this special edition. What do we think about what they're saying about what goes on in our healthcare institutions, our hospitals, etc.?
Well, you know, Al, it's really important. You can't really emphasize enough, and it actually starts at the college level. It needs to be inclusive in the schools, as we are getting our education to become those providers. And it then gets re-emphasized by the institution that you choose to work at as a medical provider, and really needs to be part of that culture. And Holy Cross has made great efforts to ensure that if it didn't happen prior to coming to Holy Cross, that it happens once you do.
Mm-hmm.
Yeah, it's really important that as an institution, the leadership of the institution understands the importance of diversity and inclusion. I was a patient at Holy Cross last year, and it was so heartwarming that I was able to have my husband's name up on the board. Not my friend, not my roommate, but he was my point of contact, and he was respected, as he should be, as my husband. And those small steps matter. It's when we train our patient access staff, who first interact with the patients when they come in, that they know how to ask the right questions, how to make sure they understand the importance of the correct pronouns, not misgendering folks, especially our trans community, which, as we know, is very much under attack in our society, especially in our state. So we at Holy Cross feel that it's our responsibility as we serve in the spirit of the gospel, right? In that spirit of inclusion, of love, that when folks come to our facility, they know that they are welcome. Not just welcome, but celebrated.
I'm curious beyond, and we'll talk a lot more about the Holy Cross experience, but I'm curious broadly from the different levels of institutional healthcare that you represent in different ways. Does it surprise you that the British Medical Association is drawing attention to the fact of the great disparity that goes on in healthcare delivery? The idea that only a little less than a third of heterosexual healthcare providers, nurses, doctors, clinicians, whatever it might be, think that discrimination or inclusivity is an issue, where it's 3 times greater among community members. Did that statistic surprise you at all from your experiences in healthcare?
Well, for me, when I moved down here 6 years ago and I started working with Ryan White, my partner and I who moved here actually went to the same physician. And he, as a black man, I literally watched the difference in treatment of healthcare he received compared to how I received healthcare, because I had insurance and he did not. So I saw the disparities in that healthcare, and then working with Ryan White to enroll people living with HIV, and hearing those stories of people like going and they feel like they're not heard, they're not being treated well, only kind of exasperated, my role as an advocate, for this community. And, I feel like coming to Holy Cross, I found solace in that it's so welcoming. It's, from every point of view, there's not issue.
In broad healthcare facilities that are delivering healthcare, why do you think in 2024 we don't see as much diversity in our healthcare system that we would want? Why do you think it happens?
So, as you said in the intro, I teach at FAU, so I have a pretty good window into what's happening in pretty much in all the healthcare institutions in South Florida. And I think the answer to your question lies in leadership, right? So if you have a leader or a group of leaders who understand that diversity, equity, inclusion, and belonging are important, we see that in the LGBT community, Q community. We see it also in the African American community. We know that, for example, African American women die at 3 times their infant mortality is 3 times that of white women, right? So there's a systemic racism built in. So I wasn't surprised by that statistic. But for me, it was like, wow, okay, we need to just work that much harder, not just only at Holy Cross, but throughout healthcare. And I'm teaching master's level healthcare leaders of tomorrow. And I have this conversation every single semester with my students is, how do we first call it by name? Right? Give voice to those who don't have a voice. How do we talk about these issues that are difficult to talk about, right? Just in general in society, and certainly today in our state. So that's my first challenge to my students is I want you to think differently. And FAU is a very diverse school. So my African-American students, they relate right away because they've been there. And then, we'll do a little round table discussion and they'll share their personal experiences, similar to what you said about your partner. And I think, first of all, we have to call it by name. And second of all, the leaders of healthcare in this community need to invest in training, in awareness, and helping people understand the other is not really the other. We're all in it together. Mm-hmm. And I think when that happens, and you see it, there's a number of institutions in our market that have embraced diversity, equity, inclusion training specific to LGBTQ. And frankly, there are others who aren't so excited about it. Mm. And so I think that it didn't surprise me at all, to be honest.
Kim, I'm curious from your standpoint. You sit at a senior vice president level at a major hospital healthcare group here in South Florida. Do you see, representing Broward County, for example, the state HIV/AIDS organization of healthcare professionals, have you, through your career, do you see it improving, or is it staying the same, or have the days of what we've watched over the last couple of years actually worsened the situation?
It's changed. I think in general it has definitely improved, but those folks who were marginalized before are still marginalized today. And that's where the greatest efforts need to be, because they suffer the most. And it's our responsibility as healthcare providers to really reach out. And that's why outreach is so important. And it's such an important component of everything that we do. Because if we don't go to the people, how do the people know to come to us? Mm-hmm. And we need to make access easy. We need to partner. We need to understand. And if we don't, we need to learn. We need to be open to learning. But I think overall, things have improved. Drugs have improved. Regimens have improved. There is more choice. It's not a handful of pills. It could be 2 pills. It could be a shot. And so therefore, that improvement has impacted many, many lives. But if you look at who has benefited the most and who have benefited the least, there is a great disparity.
Still disparity.
Absolutely.
I'm also curious from the standpoint of where we are on how a healthcare system, and when I use the phrase healthcare system, it's focusing on a hospital, a healthcare group, et cetera, that provides and delivers services for the LGBTQ community. When you're trying to make the commitment for diversity and inclusion and the attempt to educate medical staff in understanding why it's important, et cetera, we hate to talk the politics, but I'm forced to talk the politics a moment where we see in states, including Florida, that we have demonized the word diversity and inclusion. When that happens in politics, how does that trickle from the political standpoint into healthcare delivery? What happens in diversity and inclusion when that happens?
I'll start if you don't mind. Sure. For me, I feel like it's policy, right? It's I feel every organization should have policies and procedures written that support that community, the LGBTQ plus community. At its entirety, whether it's staff related, what it is, but if those policies are in place, there's no institutionalized directive for them to make those changes. And I think it does start with policies.
Yeah. But I guess broadly, and while I understand that, I guess broadly I'm asking, and maybe there isn't an answer to this, that when we are watching a Fox News that is anti-diversity and inclusion every single day, 40 times a day, and it comes out of governors' mansions, and it comes out of some quarters or many quarters in the Capitol. How do healthcare systems fight the idea that diversity and inclusion is really important, not only to be adopted by that healthcare system, but that it should be a policy that is good for our community, our local community, our state, our nation, et cetera? How do we fight that?
Well, as healthcare professionals, we take an oath to care for all. And all is inclusive of all. So, what's happening at the political level and what's happening inside the hospital rooms, what's happening inside a physician office, what's happening as a relationship between nurse and parent or nurse and patient, we've taken an oath to care for you. And that oath needs to include everybody who is in that bed, who is on that exam table, who is walking through the door.
And to add to call out the elephant in the room. Policy and politics have the same root word, if you will. And so it's a 4-letter word, vote.
Yeah.
Vote for people whose values are aligned with yours. For example, just this week, the Biden administration issued a directive using its authority to inform hospitals and healthcare providers that they must take care of LGBTQ, specifically trans folks, in the same way without discrimination. So that's one example. You have competing interests at a state level that, unfortunately attempt to demonize the LGBTQ, especially the trans community. And we as healthcare leaders just need to double down and say, look, we took an oath. Luckily now also the regulatory environment. So we have the Joint Commission of Healthcare Organizations, which is an accrediting body which basically contracts with Medicare to let us be Medicare providers. Very simplistic. They come and they survey us. Well, they now have required us to collect SOGI data, right? And Kim can talk more to the specifics. So you're seeing that movement. But it really, as Kim said, it's at that bedside. It's when that doctor or that provider, that nurse, that social worker, that caseworker, whomever it is that's interacting with that patient and family, to remember that they are a patient, full stop. And we're not supposed to decide our own, implicit biases, which we all have, right? Mm-hmm. So it's to the extent that we can control those biases. I give my students an assignment at FAU called the Harvard Implicit Bias Test. And if you ever want to spend a few minutes, it's free. You go online and you type in, and it measures how quickly you respond to different things. You can pick, there's like 40 or 50 different categories that you choose. And I'm always fascinated I don't ask my students what they learned, what were the results, but I typically ask them, what did you choose? And it's amazing to me how many students do choose LGBTQ or race or skin tone or poverty level, right? There's even one about math, which I thought was hilarious. But I think that's really the key. The key is for us as leaders to put our foot down and say, look, we took an oath. We're here to serve. And we just must do it. There's no, to me, there's no gray area, right? It's
not up for debate.
It's not up for debate. People are sick. They need our care. End of story.
Yeah. Before we close out the conversation on this headline, move on to Vaughn. The timing of this reporting was particularly ironic to me. I was referred by my doctor to a specialist at a major hospital in the area of Fort Lauderdale, and the doctor was very pleasant, and he asked me, "What do you do?" And I said, "Oh, well, I work with Hotspots magazine and Happening Out." He had absolutely no idea what that was. I said, "I'm associated with the most popular LGBT evening news show in the country on Apple," I referenced, and I said, "It's called Queer News Tonight." And he goes, why is that here? And he had no understanding of the LGBTQ community in Broward County. And I said, this is one of the largest LGBTQ communities in the nation. Right. And he goes, "Oh, I didn't know that." And I thought, you're in a major hospital. You probably see so many patients, and if you're not affirming to the community, how can your bedside, even in your office, be great? And it was just interesting to me, which is really the value of
very interesting
the story. Exactly.
A huge learning opportunity.
And no questions. There was no follow-up. It was, wait, maybe perhaps I should learn something. And I'm laughing in my head going, wow, it's really interesting.
The lack of curiosity amazes me sometimes.
Yeah, that's exactly it. All right.
All right, let's next queer up LGBTQ plus students and youth culture. Major study finds anti-LGBTQ plus policies have an alarming effect on youth mental health. Alarming statistics released this week by the Trevor Project, a national suicide prevention organization, reveal that nearly 40% of the LGBTQ plus youth in the United States have seriously considered suicide in the past year. This data stems from a survey conducted among over 18,500 individuals aged 13 to 24 between September and December of 2023. The findings shed light on the mental health challenges faced by queer youth, especially in an environment where over 480 anti-LGBTQ plus bills have been introduced across the nation. This survey supplemented the Centers for Disease Control and Prevention's Youth Risk Behavior Survey released last year. The CDC data stated that feelings of sadness or hopelessness were reported by LGBTQ plus youth at the rate of 69%, as compared to heterosexual students at 35%. Restated, LGBTQ plus youth are twice as likely to feel sadness and hopelessness. Dr. Ronita Nath, Vice President of Research at the Trevor Project, underscores the need for supportive communities among the recent political developments that have negatively affected the well-being of a staggering 90% of all study youth respondents. Instances of physical threats, bullying, discrimination, and conversion therapy have doubled the suicide attempt rates among the affected youth. The 2024 Trevor Project survey comes shortly after the latest report by UCLA School of Law's Williams Institute, which shows that 93% of trans youth aged 13 to 17 are in states where anti-LGBTQ plus bills have been passed or under consideration. The report noted that these growing attacks in America have been launched by radical conservatives and faith-based evangelical organizations. Against such a grim backdrop, Nath urges, and I quote, politicians, members of the media, anyone publicly debating about LGBTQ plus young people to really understand that protecting and supporting the mental health and well-being of young people, you should be up for political debate. Well, that's a lot to unpack, right? I look at a lot of things when I hear things like this, especially statistics, knowing like when I grew up, and I say that because, I was a child of the 60s. So for me, I look at the stress that we put on our youth today, and I'm not talking because of LGBTQ, of them finding their identity. I'm thinking of the things we impose on them as friends, schools, the workload that we, give them. Both parents in some cases may or may not be working if they have both parents, or they may be working enough that no one's there to take care of the child growing up. And I think the impact that we need to continue to focus on when it comes to mental therapy with our youth is staggering, because I do not believe we have enough healthcare providers out there that can really even come close to touching the service of our youth. It's very disturbing to see the numbers. And I can only see that today it's even more and more challenging. And it's a way for parents to recognize that things are different from when they were a child and when their parents were children. And they need to offer that complete unconditional love and support to find people, find organizations to help this youth generation.
I'm curious, and I really don't know what the answer is. I'm of course the Trevor Project, and I'm familiar with many of the youth advocacy organizations, nonprofits that serve LGBT students. We're broadcasting here at Sunshine. SunServe's program for youth is right upstairs from us. But broadly, in terms of healthcare systems, is issues like what Trevor Project is illustrating, is that something that the healthcare system of the United States is focusing on, the mental health and mental well-being of marginalized communities, LGBT being one? Is the health system focusing on that? I don't really know.
So it's a great question. Excuse me. My husband, Jeff, is a psychotherapist, LCSW, and he works a lot with, he's getting his PhD in sexology. So he does a lot of work in this field. And the rate and incidence of LGBTQ people dying by suicide or attempting suicide, we don't call it committing suicide anymore because it's not a crime, right? It used to be a crime, but it's not anymore. It's staggering. And there's definitely a better focus now. I mean, the Affordable Care Act, for example, also known as Obamacare, really brought to light the importance of insurance coverage for mental health, behavioral health. But it's also a societal issue, right? It's not polite conversation. It's not the niceties like the movie, right? It's people don't want to talk about it. And
Shame.
so it's shame-based, right? And so these kids who are experiencing this, I mean, listen, I grew up in a Hispanic family in New York. Did I ever think about dying by suicide? Yeah, because I didn't know anyone. I didn't have any role models, right? This is back in also a child of the 60s, 70s, somewhere in that neighborhood, about the same age.
I'm
Maude
sorry,
and
one
I.
more time?
So, the 60s. I grew up in New York. We arrived from Cuba in 66. And, you know, there were really no role models. There was nowhere I could turn as a young man. And I was very blessed that I went to a very progressive Catholic school, ironically, that was run by the Marist brothers. And they had peer group counseling back in the day. And it was there that I was able to explore who I was, and not even knowing that I was gay. It was just like I was different. But there were loving people there.
And you didn't know why.
And I didn't know why.
Mm-hmm.
But I had no role models. I couldn't go online and research, you know, openly LGBTQ anything. There were no openly elected leaders. There were no news anchors. There was no Anderson Cooper. There was no Ellen. There was none of that, right? And so I didn't have a place to go. And that's one of the reasons I think it's important for us who are LGBTQ to be open, so that kids can see, oh, okay, I can be successful and I can live and I can have a family and I can have a future, which is what we all want, right? I can be loved and have love. The more we do that as openly LGBTQ people and allies, the more we will drive that point home. And I think systemically as a healthcare system, we're doing a better job of identifying behavioral health issues. Even at the university, you know, we have a very big focus at FAU on the mental health of our students. And I take a special understanding of it because of my husband's background and also my personal experiences. And it's interesting because it's hard to talk about. Like if I'll see a kid who's really struggling, I'll pull them aside and just try to have a brief conversation and then make a referral. I think more of us in healthcare and in education, frankly, need to do that. That's where it's going to start, is we need to be verbal and let people know it's okay to talk about those things. There's no shame in how you feel, right? It's more about how do we get you to a place of mental health.
It reminds me when you make that observation, Harvey Milk in 1978 says the number one obligation that we have is to come out, because if we represent ourselves in the community, that is the greatest, fastest action step that we could have for a community. As it relates to mental health, we're sitting in a state, and many states are sitting in situations where we live in don't say gay environments, and as a result, that has to exacerbate these feelings of isolation and loneliness. Is there a role for medical professionals, healthcare systems, etc., in this environment of what's happening in schools and what's happening in our libraries? And you can't read a book about two male penguins just adopting an egg and making sure it's okay. Are there roles for healthcare or?
Absolutely. Maybe you'll talk a little bit about, but I know recently you were at a college campus locally, and you had a table set out as part of an outreach event, and we had rainbow bags, and they say Holy Cross. And what did the youth say to you?
Oh, so I had 4 students that come running up, and they're like, "Can I have one of those gay bags?" That was the first thing they said. And I was like, of course you can. You know, I was cracking up because the way they were so excited. And so I started talking to them, and I was like, so do you have an LGBTQ plus youth group or a group here at the college? And they're like, we're not allowed to. But we're the Crayola Club. And I was like, oh my gosh.
Isn't that fabulous?
Fabulous. So
The crayon.
The Crayola.
All the colors.
Crayola.
I know,
All the
but
crayon
all of
colors.
the colors in the
Yes.
crayon.
And all I could do was just give them my cards and say, call me. You have any problems? I'll connect you. I may not know the answers, but if I don't, I'll find out who does.
Yeah. You know, we reported just this week the LGBT on-campus center at the University of North Florida 7 days before graduation closed this week.
Wow.
And presumably many other university LGBT centers will do the same thing in following the rules. That's a lovely story. I'm glad you shared that. But very specifically, what kind of role, given the stress that's happening to young marginalized students, not just LGBT, but we're focusing on LGBT, what role or what are there action steps? And if they are, what might they be?
Well, education, and as Rudy said, making the whole conversation a norm and not an exception. That it's okay to talk about when you're having a bad day. It's okay to talk about when things aren't going your way. And it's okay to talk about when you don't fit and you don't find fit, and who can I go to speak with? It's real important everybody knows the 988 number, which is a national number, that if you're feeling in crisis, you need someone to talk to, that's your go-to number, 988. Just like you would call 911 for a physical problem, you call 988 for a mental health problem. And locally, you can also call your 211 operators. There are support systems available, whether it's online, by telephone, healthcare practitioners. It can be somebody, if you go to a church, a temple, whomever that trusting person is, to have the conversation and to know that it's okay to reach out. It's okay to ask for help. And we need to normalize that conversation so that people can.
I'm curious, were any of you surprised at Trevor reporting 4 out of every 10 youth between 13 and 23 have thought about suicide in the last year? Does that surprise you? Are you shocked?
No.
It's a pretty well documented, sadly, statistic. To answer your question about what can healthcare providers do, I think one of the biggest responsibilities we have is to bear witness, right? When we're in front of that patient in the privacy of the exam room, or when they're being talked about to refer somewhere, is being able to normalize that LGBTQ is okay. Whether it's something like wearing I have a name badge, we all do it, Holy Cross, mine has a rainbow stripe on it. Our monitors throughout Holy Cross say hate has no home here, and has, rainbow colored themes.
That's awesome.
The work that Vaughn and Kim and their teams are doing out in the community, whether it's out in the bars, doing monkeypox vaccines in the bars, meeting people where they are, and normalizing that it's okay. Here is a safe space. The whole Safe Zone project that Wilton Manors has now with the police department, we're proud to be a part of that at Holy. And I think that, and especially as a faith-based hospital, right? There's a lot, for me I grew up Catholic, there might be sometimes a fear of going into a faith-based hospital because of institutional trauma, right? And so one of the things that we at Holy Cross are very mindful of is to own that and to say, okay, we know this could be an issue. We're going to prove people wrong, right? We're going to say, when you come here, you're going to feel like you're at home. We had a wonderful recent LinkedIn post from a member of the trans community who was in our ED, and she, I think her pronoun is she, not they.
It is.
She just was raving about the experience she had in our emergency room. And that's a credit to the team, because Kim and Vaughn and the team have really worked hard to help educate our folks. And that's the number one takeaway. To the extent that the leadership of an organization makes this a priority and says, we will have a discussion. And look, let's face it, some people aren't going to buy what you're selling, okay? But when it comes to how they officially comport themselves as a representative of our health system and others, there's zero tolerance for anything but total inclusion. And that's where it's going to happen. It's going to happen hospital by hospital, doctor by doctor, provider by provider, therapist by therapist.
Rudy, do you think we'll get there?
Well, I'm an eternal optimist. Do I think we'll get there eventually? Yes. Do I think it's going to be a lot of work? Yes. I think the real question is, must we get there?
Yeah.
And the answer is yes.
Yeah.
We can't afford to have 40% of our kids dying.
And we have to hold people accountable. And we have to take people aside when you overhear a conversation that isn't just, and to say, hey, when you referred to XYZ, that's just not okay. And that's not our values. And look at the hurt that's caused by that. And to really look at it as a learning opportunity, but to call the person out nicely, but to let them know it's not okay.
Yeah. To close up our conversation about what's happening to LGBT youth, 2 quick observations. First, I frequently make the joke, older, privileged, white, gay guy on Wilton Drive, I'm okay, I'll be fine. But that's really not the point. There are so many people that need our help in our community, and this story focuses on that. And because of that, I just want to close by saying very specifically, we thank our advocates in community. We want more healthcare advocates, but organizations like Safe Schools and organizations like Pride Lines and their community center in Miami-Dade County and SunServe, in terms of what they do, they're vitally needed. And if we only think about ourselves, even in our own community, we're not really helping our entire community.
If I may, I was having dinner, my husband and I were having dinner about a month ago with some older white gay male friends. And we're at Chef Nate's, and they were saying, oh, I don't understand why they, whatever they are, have to have that trans flag over there, Justin Flip and Bark. I was shocked, because this is someone who's really, intelligent, someone I've known for years. And I'm like, what are you talking about, man? Like, well, that's not our struggle. I'm like, whoa. Okay, remember that if it were not for people of color and trans women and men at Stonewall, you'd still be in the closet married to your wife and doing God knows what on the side. So we have privilege now. We white gay males, I'm Hispanic also, I present as white. And I feel that we have a burden, but a responsibility of speaking truth to that power. And our sisters and brothers who are trans need to know that of all places, they're going to be safe in the greater community.
That's the action step that you just discussed. You took the action step. I love that. Let's stand up for our LGBT youth. All right, well, next, let's square up South Florida and Florida. We're going to deliver breaking news. Holy Cross Health has been recognized by the HRC as one of the best in America for LGBTQ+. This is breaking news that came this morning from the American Hospital Association 2024 conference, Accelerating Health Equity. In an unprecedented achievement, Broward County's Holy Cross Health has earned the LGBTQ+ Healthcare Equality High Performer designation in the Human Rights Campaign Foundation's Healthcare Equality Index. This is the first time the faith-based hospital healthcare system has been recognized like this by the HRC for their achievements for the LGBTQ+ community. The 2024 Accelerating Healthcare Equity Conference is happening right now in Kansas City. This prestigious designation was awarded in the 16th edition of the Healthcare Equality Index. Here's how it works. Out of over 7,000 healthcare facilities in the United States, a record-breaking 1,065 of them actively participated in the Health Equity 2024 survey and scoring process. 462 of them, I was going to say just 462, but we're happy there's 462, received the LGBTQ+ Healthcare Equity High Performer designation. Even more significance on this morning's news is only approximately 15 faith-based hospitals and health systems received the recognition of outstanding healthcare delivery for the LGBTQ+ community. Holy Cross Health is one of them. Kim Saiswick, Vice President of Community Health and Well-Being, stated, quote, "Health inequities and systemic differences in health status of different population groups, social determinants of health such as poverty, unequal access to health care, lack of education, stigma, and racism are underlying contributing factors of health inequities. Turning the tide of these inequities is not only possible, but also imperative. Holy Cross Health has recognized this, making health equity an explicit and implicit priority. Holy Cross Health is an agent of local change and is changing the narrative, taking action that will promote health equity. These issues are an important priority for healthcare professionals year-round." I loved this part, not just during Pride Month, end quote. Continuing its leadership, Holy Cross Health has also ranked in the top 25% of America's best in-state hospitals in 2024. Kelly Robinson, president of the Human Rights Campaign, also emphasized the importance of the inclusive healthcare services and fighting discrimination. Robinson said, quote, LGBTQ plus people and their loved ones are looking for healthcare providers to offer and champion fully inclusive services. The Healthcare Equality Index is helping people find facilities where welcoming policies and practices are the standard. We know that LGBTQ people, especially our trans family, continue to face discrimination in the doctor's office. No one should have to put their health on the back burner for fear of mistreatment in a healthcare facility or by their doctor, end quote. Being a Catholic, not-for-profit community hospital makes today's announcement even more historic. Holy Cross sits in the shadow of one of America's largest and best LGBTQ plus communities. Holy Cross serves as a beacon for marginalized communities welcoming and meeting LGBTQ plus healthcare needs. To learn more about Holy Cross Hospital, all you have to do is visit holy-cross.com or connect at Holy Cross FL. Well, first off, wow, congratulations.
Yes.
Yeah.
I am sitting at Sunshine Cathedral at the studios here at Happening Out, and every single day have to explain to LGBT, wait, religion doesn't necessarily have to be a rejection. And almost every conversation I have about Holy Cross is, wait, give it a second look.
Mm-hmm.
And now the HRC says, oh yeah, we did.
We give you the
Congratulations.
Yes,
Thank
thank
you.
you.
What did y'all
Thank
think
you.
about this morning's news?
We were so excited. And wished we could be in Kansas,
Yeah.
but our shoes
Well, you
didn't
had to
work,
be at Queerness
you know?
tonight.
Right.
Yeah, we had to be here. We wouldn't have made the flight. But we're so excited. It was a lot of work put into the documentation of what we're actually doing, but well worth it.
Yeah.
And we're really thrilled because we know the community recognizes that designation and award status, and it's another way to say, come to Holy.
You know, it's interesting on that observation, because I want to certainly fold y'all in on your reactions to the award. But this is different. I just want to take a highlighter to what you just said. USA Today says, here are the good hospitals in America, and the American Medical Association says, here are the good hospitals in America. But the HRC is a whole different thing.
Right.
Because they are focusing specifically on the delivery for marginalized community, LGBT specifically, focusing on here are the checks that you really have to accomplish to vertically through the entire hospital or healthcare system say, wow, you're succeeding for your patients. And that's what the HRC recognition accomplishes. Other reactions? Both of you being members of our community, you just must have been thrilled.
Well, I mean, I'm incredibly proud, right? So here I am, the first openly gay board chair of Holy Cross, and in the same year, through the hard work that Kim and Vaughn put to getting, and a lot of other colleagues, we have this sort of good housekeeping seal of gay approval.
That's right.
And I think that that's so incredibly powerful. I know that our CEO, when he got the news this morning, our board members are just delighted. Of course, they knew we had applied, and you're always on pins and needles a lot. I mean, it's very comprehensive. It took months and meetings, right? Kim and Vaughn. I was involved on it kind of tangentially, but these guys put it together. And we know in our hearts what we do, but to have this outside accrediting body in a way, tell us, hey, you guys are doing a great job as a high performer in LGBTQ healthcare. It just is the icing on the cake. And I think it also has created some interesting dialogue with our colleagues at Trinity Health, which is our parent company, which has over 90 hospitals, who now are looking at Holy Cross and saying, oh, well, we need to do this at our hospitals, right? So we're helping create not just local system change, but also nationally.
Let's take that highlighter and make sure that we zero in on this, because I don't think most of our listeners might necessarily understand what you just said. Holy Cross Hospital is owned by Trinity Health, which has 90 hospitals around the country. Trinity is a major healthcare supplier in the United States. What you're saying is because of Holy Cross is, Trinity Health is faith-based for all 90 hospitals. All of them are faith-based. So because Holy Cross was able to accomplish this for LGBT, it first says, first and foremost, that great health care and LGBT embracement do not have to be exclusionary.
Correct.
That's the first thing that this recognition from HRC says. And then second, what you're saying is you can use Holy Cross's example in terms of what Yvonne and a Kim and a Roy and others, hundreds and thousands likely, are doing, and say to the entire system of the other hospitals, you can do this too. That's what you're saying.
That's right. And in fact, Kim worked very closely, Kim and Vaughn, with our system office in Michigan. We're very lucky. One of our board members, Loranda Shestang, is also a board member of Holy Cross. There's always a Trinity representative on our board. And Loranda joined our board, and she is the Senior VP of Diversity, Equity, and Inclusion for all of Trinity. And she was down here in January. We took her to the Wilton Managed practice, to our other practices in town, to our Women's Center, to our cis-drunk practice that we have in the African-American community in cis-drunk. And I think she left here just so happy and impressed that the mission that she holds dear, right, which is diversity, equity, inclusion, is alive and well. And I think that inspired her, and she was very helpful, as was the system office, because there's things that we can do locally, but there were things in order to get this designation that we needed corporate approval for, right? And so in terms of policies and things like that. So it's really great, and I'm excited and hopeful that, I don't know, did any other Trinity hospitals apply? Do you know, Kim?
I believe there's one that was announced today, yes.
I didn't remember that.
Yes, in New England.
In New England. Great. So now we have 2 and 88 to go. So,
right.
But the point is that our leadership at the Trinity level, our CEO of Trinity, our senior executive team understands. One of the core values of Trinity Health and Holy Cross is eliminating racism, and all the isms, as I call it, and also servicing marginalized communities, especially those experiencing poverty. And the Sisters of Mercy, who founded our hospital, are very much advocates of that. And we actually have 2 sisters who serve on our board, and they came down for our meeting just last week on April 29th. And it was just so nice to have them here. And we had mentioned that this was in the works. We didn't know the results. They were super excited because this is what gospel action is. And and if you speak to Darrell, the pastor here at Sunshine Cathedral, I'm a member here, he'll say the same words. It's what is the spirit? What does it mean to serve in that spirit of the gospel? Right, and the spirit of the gospel is of love and inclusion, right? And that's the gospel I read. It's pretty obvious to me. And to hear the sisters, present, they did a beautiful presentation at our board meeting about the pillars of the Sisters of Mercy, and it was all around social justice, helping the poor, very similar to your 11 pillars, actually, that you put forth earlier. So I'm really proud of that, and I think that this will just continue to also then give permission, if you will, to other Catholic health systems. There are many in this country. Trinity is only one of them. To also take a second look.
Can, from your words to God's ears, literally, can we get the Baptist to come along with us?
Well, yeah, actually, interestingly enough, when I was at ACHE, the American College of Health Executives has periodic networking meetings, and actually Baptist Health also is involved in this process locally down in Miami and up in Palm Beach. So yeah, I think a lot of this is being driven, Kim, correct me if I'm wrong, not only is it the right thing to do, but hospitals are being told by the Joint Commission, you need to get your act together on this. So I'm not surprised at this record number of applications, because ultimately, if you don't do this, you could jeopardize your Joint Commission accreditation, which, among other things, is the Good Housekeeping seal of approval, but also something called deemed status, which basically means if Joint Commission says you're okay, you can get Medicare funding.
Yeah.
If they don't, you won't.
Yeah, and this is not put on the pretty dress or put on the pretty suit.
Oh, no.
You have to walk the walk.
Oh, yeah.
This is
very intense.
This is done every 2 years, and the detail of the implementation in a corporate structure for a healthcare hospital or a healthcare system is incredibly.
When Kim first approached me with the project, I'm like, oh, okay, I'm a data person. I love working with data and information, right? I thought, okay, this won't be a problem. Oh my gosh. 2 5-inch binders of documentations that we had to submit. We were scrutinized under a microscope.
Yeah.
And it's awesome that we could say, yes, we've done this. Yes, we've done this.
That makes the the sauce for the
Right.
goose.
Mm-hmm.
This is really important
Yes.
Yeah.
in getting this recognition.
And it's not something that you could go down a checklist today and accomplish.
Yeah.
You have to have a track record. There has to be a history. So it really emphasizes that if you're interested at all in this work and getting this type of recognition, you better start today because you're not going to be able to apply until tomorrow.
Right.
And so it forces people. Yes, the Medicare and the JACO, it's tied to it, but that's not why we're doing it. We're not doing it for the bottom line. We're doing it because it's the right thing to do
It's the right thing to do.
people.
Right.
Yeah.
and to serve.
Yeah.
Yeah.
I agree, and I think we're doing it for that reason.
Yeah.
I don't know if everyone
I
might
agree.
be doing it
I
for that
hope.
reason.
Yeah.
But the point is, it's being done, and I have to really hats off to HRC, right? Because for years they've had, I guess this is the 16th year now of this index,
Yeah.
and I have to really applaud Human Rights Campaign because they have created this environment where we're awarding healthcare organizations for this kind of behavior, hopefully for the right reasons, like Kim mentioned. People have to come around for whatever way they get there, right?
Yeah.
As long as they get there. So that,
that's
I would love it that every single hospital in South Florida have the same designation.
Well, and that was going to be my follow-up here. So this recognition, just first, it's and again to emphasize, the name is Holy Cross, and being able to get this recognition from HRC, which is a representation that really you are walking the walk. What do you think the ramifications of this recognition will be? Broward County is a great county for LGBT. Miami-Dade County is a great county for LGBT. How do you think this is going to resonate on other healthcare systems and other hospitals around you?
Well, we certainly hope they'll catch on. Absolutely. And see us, at the forefront of this and say, they have been at this event and they have done this. And, if you talk to people in the community, you get very positive results and positive accolades for the hospital, the physicians, the practitioners. So it's my hope that they would embrace it and join us.
And from your seat as the board chair at Holy Cross, what is your thought to that observation? How will this resonate with peer healthcare hospitals and systems around you?
It's a good question. I think some of it will be a little bit of envy.
A little envy goes a long way for positive things.
And respect.
Yeah.
And again, one of the missions of Holy Cross is to be a transforming, healing presence in the spirit of the gospel. That is our mission statement. And I think from a board chair seat, this just continues to further the mission.
Yeah.
Right? And helps other organizations who maybe weren't sure. And hopefully it'll go beyond the walls of Broward County. It's a very progressive county. Hopefully, up in the other parts of the state that maybe aren't as progressive as we are, that they'll say, gee, a Catholic hospital in Fort Lauderdale just got the high performer status from HRC. If it's okay for them, maybe we ought to be looking at that.
Yeah.
Like, it almost creates cultural permission, right, for other faith-based organizations to look at.
One of the examples that I have to bring up is how Holy Cross, from my seat and watching what you're doing, how you're integrating in community. At the end of the day, you walk the walk. You want to be a great healthcare provider. That's the number one thing, clearly. But to be able to do that, you can sit inside the walls of your castle, or you can cross the moat and come out into the community.
Absolutely.
And it's one of the things that I have noticed, and of course, led by the two of you. And Vaughn comes on anchoring at Queer News Tonight, and he'll do an event. And you recently did an event that was held in a chapel. And I don't remember the exact details. That's not really the importance of it. But he talked about the event, and so many of my friends said, "Wait, this is an equity and LGBT encouraged event in a chapel at Holy Cross."
Absolutely.
And wait, what's going on there? And it was an illustration of you're coming into the community saying, we want you to come in, and we are going to be affirming and embracing, and we're coming to you.
Right.
It's examples of how you're really deciding this is how we're going to bring our message and our mission into the community.
Right. Yep.
Go ahead.
Oh, no, I was just going to say, for me, the importance is, especially since I work so much with HIV, is when we look back in history in the 80s, people today don't realize or understand, as I call it, the horror of HIV/AIDS. And I think it's important that we continue to tell those stories and who were on the front lines during that time. And I think that's a very important lesson to be learned when we talk about the church and we talk about, the people who were involved.
And that event, which was a celebration of an author who wrote a book called Hidden Mercies. And it talked about the involvement of Catholic, both laity and nuns and priests
in the AIDS crisis.
In the 80s, in the AIDS crisis. And I actually lived through that. I was a young nurse, very young nurse, in New York City at a Catholic hospital. And there were 3 basic hospitals that cared for these guys, and it was mostly guys at that time. Was Cabrini Medical Center, where I worked, St. Vincent's, and St. Clair's. And Mike, the author of the book, basically chronicles through first-person interviewing and through research. And he's a young guy. I was surprised when I met him. He's like in his late 30s, but he's a scholarly researcher. And it brought back a lot of memories. Some of them were kind of sad. So many friends that we all lost who come from that era. But it also was very powerful to hold this event in our chapel. Mary Carter Warren, who's our mission leader, she just did a fabulous job bringing this gentleman here with Kim's support and the leadership support to talk about that story, because they are hidden mercies. This is not anything new. We're at Holy Cross, we're just on the shoulder of those sisters and those priests back in the day who were there when no one else wanted to care for these guys, right? So,
Rudy, you do understand, however, you're telling a story that a very significant percentage of the LGBTQ community would go, huh?
Right.
I agree.
Understand that.
100%. And I mean, I get it. When I was asked to serve on the board, I had phone calls from friends. They were like, "Are you sure you want to do this?" I'm like, "What do you mean?" They're like, "Well, it's a Catholic hospital." I'm like, "Yeah, I get that." I said, if anybody knows that I don't do anything unless I can speak my mind. And so I didn't have any fear. And in fact, I will say, when I first joined the board, I wasn't sure. I'm the only one, the first one. But the response from my fellow board members has been incredible. People that I would have never thought would be an ally all of a sudden share that, "Oh, my brother is gay," or "I built my business here with a lot of LGBTQ support and I'm very supportive of the community," or "My sister is trans." I mean, it's just so interesting to listen. But you're right. I mean, there's a little bit of a shock value, right? But I just keep telling people the same thing. It's your own implicit biases, right? You think, "Oh, it's Catholic, or it's not going to work for me." And I get that, not to minimize that. There's trauma involved, right? Those of us who grew up in the faith not always had the most positive, and still to this day, there's still some mixed messaging happening. But we just are easily for us to say, because we can challenge and we can sort of write our own narrative at Holy, that at our place, you're good. You come in, doesn't matter what your faith tradition is or not, doesn't matter who you love or not, doesn't matter who you pray to or not. And we're trying really hard to work in relationship with our communities, not only the LGBTQ community, but the Jewish community. We have a
Black community,
the African American community. We are the only healthcare provider, thanks to Kim and her team's efforts, in the Cis-Trunk neighborhood of Fort Lauderdale. In the site of the old segregated hospital. Holy Cross DNA is of inclusion. When the hospital was open, our first CEO, who was a Sister Innocent, in the 60s, overnight integrated our hospital. Remember, in the 60s, hospitals were segregated. And she didn't have to go to a committee. She didn't have to go to the board. She didn't have to go to the governor. She's a nun. She answers to a higher authority. And guess what? Overnight, Holy Cross became the first hospital in Broward County to employ African-American physicians that was not an African-American hospital, right? So we continue in that fight. And there's other communities. We talk about the Muslim community. We talk about other communities that share our neighborhood, right? That everyone needs to feel welcome. And that's just, for me, why I joined this board. My why is specifically for the LGBT community, to help create that bridge of understanding, not only from the hospital's perspective, from the community's perspective. And what Kim said about being there every day, not just on Pride, that's super important, because last Pride we were there, as were a lot of other healthcare systems, but day in and day out, who's at the bars, who's in Wilton Manors, who's going to the parades, who's doing Pride Fete, who's doing all these different events that impact all aspects of the LGBTQ community. It's Holy Cross, and I'm so proud of that.
Yeah, and to listeners on the news, on this breaking news of what's happened in Kansas City this morning, this this wasn't last week. Oh, let's try to do this. This has been a 2-year journey for you. For
the application.
Yeah, right.
But the work
is years,
more than
decades.
Exactly. So it's great news. And with a little wink and a nod, how will it feel to be the gay embracing hospital in South Florida? Boy, who would have ever thought that?
Well, I think we kind of always have been.
Yeah.
It's just it's exciting to because what this does, it communicates to people who maybe are on the fence, who maybe don't know if they can feel safe coming to Holy.
Yeah.
It's just another way from an outside organization, not us tooting our own horn, right? It's a very well-respected HRC, right? National organization saying, you know what, it's okay. When you go to Holy Cross, you're going to be treated with dignity.
Yeah.
And that's what it's all about, dignity, number one.
Yeah. Well, congratulations.
Thank you.
This is
Thank you.
really big news.
Yes.
I don't think to our listener and perhaps to you too, I'm not sure that it has digested how big of news this is, especially because it's Holy Cross Health. So congratulations.
Thank you, Al.
Thank you.
And thank you for
Thank you.
having us this evening. It's great.
All right, next, we are proud of our special partnership with Sunshine Cathedral, the world's largest queer church here in Fort Lauderdale. Supporting that partnership, we are broadcasting from the permanent set here in Sunshine Cathedral at the Happening Out television studios. We broadcast Sunshine Cathedral Sunday International Service at 10:30 a.m. That is today's news for the LGBTQ+ community on the world's first and only daily LGBTQ+ evening news show.
If our community is important to you, share this news with your friends and family. Are you, like most of America, part of our very large television audience watching this live LGBTQ+ news broadcast right now on Roku, Apple TV, Android TV, and Amazon Fire TV?
Queer News Tonight is the only live LGBTQ+ digital television show in the world that is out of the closet and into the headlines. We need your support if our community is to grow. We must tell our stories and bring them to the attention of the broader world.
This is the only place in the world that tells these types of LGBTQ+ stories in motion and sound. That is the passion of Hotspots Magazine and Happening Out Television Network and Queer News Tonight. I'm your anchor, Al Ferguson, and on behalf of these LGBTQ+ reporters, the anchors tonight of Queer News Tonight's LGBTQ+ Healthcare Edition with Holy Cross Health, including Kim Saiswick, Vaughn Biggs, and Rudy Molinet. We will see you daily at 8 p.m. And to our LGBTQ+ world, we wish you
Good night.